Good day to all. Welcome to NGP's Expert Talk series. This is Tharshini of Grade 12 here to take you through the interaction. In 2050, one person could die every 3 seconds if AMR is not tackled now. AMR is an urgent global public health threat, killing at least 1.27 million people worldwide and associated with nearly 5 million deaths in 2019. In US, more than 2.8 million AMR infections occur each year. We in India are also concerned with the increasing infectious diseases. What is this AMR that I am referring to? Well, AMR is antimicrobial resistance, which takes place inside our body. Antimicrobial resistance occurs when bacteria, virus, fungi and parasites no longer respond to antimicrobial agents, meaning they develop the ability to defeat the drugs designed to kill them. As a result of drug resistance, antibiotics and other antimicrobial agents become ineffective, and infections become difficult or even impossible to treat. The World Antimicrobial Awareness Week is observed from 18 to 24th November every year. It is a global campaign to raise awareness and to reduce the emergence and spread of drug-resistant infections. The theme for this year's World Antimicrobial Resistance Awareness Week is Preventing Antimicrobial Resistance Together. Well, all the details about AMR that I gave was from the World Health Organization's report. To hear more about it from an expert, I introduce Dr. Varun Sundaramurthy, MD, General Medicine, Consultant for Infectious Diseases at Kovai Medical College and Hospital. Dr. Varun had pursued his medical degree from the PSG Institute of Medical Science and Research, Coimbatore, from the Christian Medical College and Hospital, Vellore, and from Dr. MGR Medical University, Chennai. He has a broad range of experience working with well-established clinics and hospitals across the world. To name a few, Dr. Varun worked in an observership transplant for infections at Henry Ford Hospital, USA, as an observership in infection in cancer patient at Wayne State University, Detroit, USA, also served at the Clinical Tropical Medicine at CMC Vellore. To such an eminent personality in the field of medicine, I extend a warm welcome to our Expert Talk series. Good day, Doctor. Glad to interact with you on this World Antimicrobial Resistance Awareness Week. Doctor, I just shared with our audience some basic information about AMR. Could you please explain the antimicrobial resistance, how it occurs and what it means?
Good morning to one and all. That was a very clear in what you speak. This antimicrobial resistance is a very, very important topic of interest nowadays, and we need a more detailed discussion on that. But before that, you need to know what is the association between you and the bacteria first of all. Only then you can easily tackle when are we supposed to use antibiotic, and when we are not supposed to use antibiotics, you'll be clear about that. To know that, you need to know some concepts on that. One is that the number of bacteria you have in your body outnumbers the number of cells you have. Meaning you are a sort of bacterial mass, big mass. In case if you take antibiotics unnecessarily, that will create a lot of problems. So for example, from general, the food you take will get digested, and the nutrients you needed will happen to get through this bacteria, and this immune regulations, and it has a hell lot of functions to do. For example, this immune regulation, apart from that, it prevent the other bacteria, foreign pathogenic bacteria invading your body will be prevented by this commensal bacteria you have in your gut. So it has a lot of functions to do, and a lot of other disease when you number from every organ. For example, central nervous system, cardiovascular system, myocardial infarction, there's multiple sclerosis and memory loss and obesity. Name any disease that has to start with, there would be some infection that would trigger this sort of an inflammatory response. So to tackle that, what you are supposed to do is that you need to avoid using antibiotics. Nowadays, you know that lot of areas where they use antibiotics when it is not necessary. For example, sinusitis, simple viral infections, where it can be tackled with supportive treatments. They prescribe antibiotics. That is unnecessary, because when you put them on antibiotics, you not only kill that particular pathogen, but also you kill the other commensal bacteria in your body that has a lot of functions to do. When you alter this microbiota, what happens is that there will be a unnecessary inflammatory response that would create a lot of problems, leads to disease and as well as even sometimes malignancy. So to overcome that, you should avoid using antibiotics. Coming to the topic core, this antimicrobial resistance, every bacteria has an resistant gene, and you, by giving them on antibiotics, what you doing is that you triggers an unnecessary repression of those resistant gene. So that what happens is that that will make the bacteria more resistant to this antibiotics which you are giving. For example, if you take some bacteria from the Arctic Ocean or some other deep in the caves, if you isolate some bacteria and if you check for a resistant gene, that bacteria would definitely will have a resistant gene, but that won't express those genes. But in case if you put them on unnecessary antibiotics that select out these resistant genes and make the bacteria more rough, rugged phenotype, that would be very, very difficult to eradicate in case if you put them on antibiotics. And coming to the question, proper antimicrobial resistance, when you use antibiotics unnecessarily, especially in an inappropriate dosage or inappropriate frequency, you are killing the normal commensals and you are selecting out this resistant bug. This selected out resistant bug would be very, very difficult to treat. That would lead to a lot of mortality and morbidity, and this is contagious as well. This might transfer from one person to other. In case if I am harboring the resistant bugs, there is a possible chance that I can transmit the sort of colonizing bug into my family members, and over a time, in case if that our immune system is at the haste, there is a chance that they also would get the problem. So we need, this is a serious problem. Even UN summit, they have been discussing on this antimicrobial resistance. To put it forward, we need to have a close watch on that. We need to have an active intervention to prevent that.
Thank you, Doctor. I am sure that people will now understand the seriousness of this antimicrobial resistance. For my next question, Doctor, what are some of the factors that contribute to the rise of antimicrobial resistance?
I would say everybody knows that it is because of inappropriate usage of antimicrobials, and everybody has an access to the antimicrobials. Even in case if somebody has a common viral infections, they get an easy access through the pharmacy, and they are getting the medication over the counter. And whenever somebody walk into our OPD, they say that I had an infection, I put amoxiclav or azithromycin, I took this antibiotic, that antibiotic over the counters. We need to prevent that easy access to these sort of an antimicrobials, one. And the second thing is that whoever comes with a problem, they think the fever is probably because of infection, and they treat them with the antimicrobial. There are a lot of other conditions which would cause fever, and we need to know this antimicrobial agent are not antipyretic. So we need to get the syndromes right. In case somebody comes with a rhinorrhea, headache, nose block, that is sinusitis, that can be getted with anti-inflammatory. They don't need antibiotics. So, and most of these sort of infections are likely to be viral. So they need to get the syndrome right. Diagnosis is very, very important. If they get the diagnosis right, then they can avoid using antimicrobials, and avoiding unnecessary use of antimicrobials definitely would prevent evolution of the resistant bugs. Yeah.
Thank you, Doctor. That was really informative. Moving on to my next question, Doctor. How is antimicrobial resistance treated?
Antimicrobial resistance, for example, I will give you a scenario. See, somebody comes with a respiratory tract infection who's already had a head injury, admitted, operated, and patient is bedbound now. They put them on a ventilator. Now the patient, they have taking the secretions from the endotracheal tube, and they are sending that secretion, and that is flagging growth of an resistant bug. Does that needs treatment? Definitely not. See, if you isolate a bacteria from a particular patient, you need to know whether that's a colonizer or a pathogen. Is that a mere colonizer, or is that invading patient's tissues causing a problem? You need to know that clearly. So you need to define the diagnosis. You need to define the syndrome. Mere presence of bacteria doesn't mean you are supposed to treat it. When the patient, those sort of patients, in case if they are hypoxic and if their hemodynamics are compromised, then you need to treat that. Otherwise, you don't have to treat it. You just have to clean that particular area, the tracheostomy tube. Likewise, in case if somebody comes with a fever for longer duration, you need to get the diagnosis, proper diagnosis. We have an advanced technologies now. We have a CT scans, MRI scans, PET CT scan, and you can make use of those diagnostic techniques to get an appropriate diagnosis to know whether the syndrome which you are dealing is infectious or non-infectious. Based on that, you can make appropriate interventions. By that way, you can definitely avoid evolution of resistance and plan accordingly whether to treat or not to treat. Second thing is that availability of the antimicrobial agent. In the last 4 decades, the newer antimicrobials against this resistant pathogen are very few, and whereas the emergence of resistance is very, very high, and previously we've been seeing these resistance to 20 to 30%. Now we are seeing that same resistance touching 60%, 70%, 75%. If this goes like this, in over 3 or 5 years, we'll be nowhere. We don't have an antimicrobial. We might not have an antimicrobial agent to treat these sort of infections. So targeted therapy, and you need to plan whether the appropriate syndrome needs intervention or not. And most of the times, making a very good sanitation, proper hand hygiene would definitely help. In case if you could not do that and the patient develop infection, you treat it accordingly rather than using a broader spectrum. Give a narrow spectrum antibiotic targeting that particular pathogen. That would definitely help.
Thank you, doctor. I really hope that people now understand how simple changes can help defeat this AMR. Doctor, I would like to know how are these resistant bacteria contagious?
Definitely, that is contagious. For example, if I am having that colonized bug in my oral cavity or hands, by touching the common touch surfaces like doorknobs and the step rails, I can transfer those bacteria from me to somebody. And through proper hand hygiene and sanitation and immunization, what we can do is that we can prevent this infection getting severe, and also prevent this infection transfer from me to somebody who is closely associated with me. And apart from that, if you isolate a resistant bug, you need to isolate those patients and give a proper hygiene techniques. You need to teach them. By that way, you can prevent transfer of infections. And second thing is that we need to restrict antibiotics in the parehoods and as well as in the from the animals. For example, cattle rearing and a lot of others uses antibiotics for disease among animals, and also they want this animals and the hybrids very healthy. So they use the antibiotics very often. And will that cause a transfer of infection? Will that make this resistant bug contagious? Of course, yes. How? These antimicrobials, when you are using that on an animals, the animals will have a selected out resistant bugs in their gut. In case if that particular animal passes, poops, and touching that, you will also transfer the resistant bug to the family members and all that. When this pathogens finds an opportunity, for example, when their immune system is down, for example, somebody gets a viral infection, your immune system will temporarily be down. In those sort of infection, when there is a mucosal inflammation, these resistant bug would look for an opportunity and invade, would cause a disease. In case if you find that sort of a problem, then it will be very, very difficult. I can give you an example. One lady, who is an elderly lady, 64 years, who never been to an hospital, got admitted for an abdominal infection, cholecystitis. Never been to a hospital, but she takes care of the goats and as well as the hen and cock at her home. And she has come with a fever with chills and rigor and abdominal pain, and we did an investigation, and it turned out to be an acute cholecystitis. We took a blood and sent it for a bacterial culture, and for our surprise, it came out to be a resistant bug. Those who never been to an hospital, never treated for any problems before, has come with a resistant bacteria invading the gut. So that means that she had an exposure prior to the admission, and that was not very significant. Meaning, now been to a healthcare facility to have this sort of a resistant bug, but she has harbored that resistant bug, and now it is causing the problem. And ultimately, she landed up in a higher, broader spectrum antibiotic for 5 to 7 days, and after that, she recovered and got well. What I am saying is that we need to restrict antibiotics in use both in cattle and as well as the from farm animals, and as well as in the other agricultural areas, to avoid this becoming a bigger problem.
Thank you, Doctor. I really understand the concept better now. Doctor, I would like to know, are there any new promising therapies or approaches in the field of infectious disease treatment that you believe could help combat antimicrobial resistance in the future?
Yeah, one is that they are doing an study research on this, the antimicrobial resistance, how to tackle that. And the newer concept has been evolving under study is that phage therapy. Phage therapy, we've been using that long before for Staph aureus infection. That means you are making the virus infecting the bacteria. It's a virus infecting the bacteria. You prime the virus targeting that particular antigen, which could be anything, bacteria or some other antigen. So making use of these viruses infect the resistant bug. They are doing a study on that, phage therapy, and that would give us an answer on these resistant bugs. And second thing is that there are also a lot of research involved in developing the immunization, vaccination against these sort of an organism. I can give you an example. This we've been seeing streptococcal pneumonia infection, that pneumococcus they commonly call, no? That pneumococcal pneumonia, there has been emergence of resistance, and it's been resistant to penicillin. Previously it was 2%, and now it's evolving 20%, even more than that. And they have come up with a vaccination, and it's been working really well. So that would prevent people developing severe infections, avoid unnecessary use of antimicrobials. Like that, if we come up with a vaccine for every disease, and it would help development of severe complications, severe syndromes, that would definitely help to tackle this AMR.
While I was researching on this topic, Doctor, I realized that AMR does not only affect the people, but also invariably has a negative impact on the economy and in the environment. So I'm sure that these techniques will be a boon for the world. Sir, my next question is not about AMR, but since your field is treatment of infectious diseases, I'm curious to know this. Even during the pre-COVID times, people were aware of infectious diseases, but they were not alarmed by it. During the 2 years of COVID, people became quite paranoid and about such infectious diseases. Now, during the post-COVID days, what was the general mindset of the people? Have we begun to take infections lightly, or are we still as a society serious about it?
I would say that was a very good question, because previously we've been a lot of ads and mass media working on vaccination, and they've been saying that you vaccinate for this disease and child immunization and all that, and the awareness was not that big, even though from the younger age group, the parents, the educated parents, they do vaccinate, but we do have an adult immunization programs as well that helps to tackle a lot of infections from getting severe. And they've been saying that seasonal vaccination for influenza and the pneumococcal infection in an elderly age group, 45 years, and those with comorbidities and lot of other diseases, they have immunization. But the awareness on this vaccination and immunization came into light only after this COVID. Lot of people, based on their own experience, they understood that vaccination would definitely help preventing disease getting severe. So those who got vaccinated for COVID developed milder diseases, and whereas those who not been vaccinated got a severe disease, that too in a short span of time, and got succumbed to the illness. And that has given a lot of throw a lot of light onto the infection and the prevention strategies. And post COVID, a lot of people are coming up with an idea that for COVID you got a vaccination, and we've been having recurrent common colds and other diseases. My son is getting recurrent fever. Do you have a vaccination for that? They are coming up with a plan and they are asking for opinion on that. I want to get vaccinated. What is your take on that? Taking this vaccine, will this help? Am I supposed to take the vaccine? If somebody in the among the family is get infected, what am I supposed to do? Hand hygiene, sanitation, immunization. They have been coming up with an idea. Even without doctor patients communicating on this, they are coming up with an idea that I need vaccination. What are the preventing strategies am I supposed to do? And even if some doctors prescribe them an antibiotic, they are asking that is this antibiotics necessary now, or can we manage it conservatively? What is your idea on that? They've been coming up with a discussion. They have been very prone for an open talk. That is how this COVID has helped. And definitely the COVID has a lot of bad memories to give, but it has a good part as well. It changed the mindset of many people.
Thank you, Doctor. I truly agree with you. For my final question, Doctor, how do you educate patients and their families, especially in India, about the responsible use of antibiotics? I ask this because it is a common tendency to consume antibiotics for every simple infection.
See, for my basic understanding, when I finished my undergraduation MBBS, and when I had common cold, I remember using azithromycin and this amoxiclav, amoxicillin sort of medications. And when I finished my MD General Medicine, I realized that inappropriate use of antimicrobials would cause a lot of problems. And I've been into the study, researching on that. And what we have found is that our human microbiota has a lot of functions to do, meaning from regulating our immune system and digestion and so many other things we've been discussing. No? It has a lot of functions to do. Unnecessarily depleting this microbiota would cause a lot of problems. Dysregulated immune response, a lot of inflammatory diseases, connective tissue disorder, malignancies. So in order to tackle that, definitely these microbiota would help. So depleting that would cause more harm than helping you. So I stopped using antimicrobials on myself. So simple common cold and sinusitis and a lot of other infections where we can manage conservatively, then I stopped using antibiotics. So the last antibiotics I prescribed to myself was in August 2012. After that I haven't taken any antibiotics. So whoever comes to me, the primary important thing is that making a diagnosis. AMR and diagnosis is a very important thing, because when you get the diagnosis right, you will know that whether this patient needs treatment, whether these patients will benefit with antimicrobials. Only if it is needed, you can put them on antimicrobials. This unnecessary usage of antimicrobials would come when somebody comes to you with a severe problems, very hemodynamically compromised, sick patients, where you don't have a time to think on whether these patients will benefit or will not benefit with the antimicrobials. So it comes to you very sick, needs ICU stay. In those sort of patients, there are no other go. If you think infection, you are supposed to treat them. So put them on a broad spectrum antibiotic, wait until the blood culture reports are out, look forward for improvement in the hemodynamics. In case if that is happening, then if the blood cultures are out, then you need to optimize the antibiotics. Whether this patient need a broader spectrum, or shall we narrow down this antimicrobials agents. And that one we need to take a call. That is very, very important, I would say. And the second thing I would say is this sanitation and vaccination. The sanitation and vaccination is very important, because prevention is the most important. Just simple hand hygiene and wearing mask would help. For example, during the COVID times, most of the patients and as well as the common public are wearing mask, and we haven't seen any sort of influenza viral infection at that point in time. Now we stopped wearing mask and we see a lot of influenza. In the last 2-3 months, we've been seeing a lot of patients, especially elderly gentlemen, young children, school-going children coming up with influenza, severe infection. For children, of course, it is sometimes difficult because younger age, we can't make them complain to this mask, but we are mentally sound. So young age, middle age, and as well as the elderly gentlemen, we are supposed to insist them to wear mask in the public. So, and simple hand hygiene would prevent them from getting infection. and as well as the transferring infection from one part of a region to the other. And this also, like you rightly said, this will definitely harm the nation in the travel, tourism, etc., etc. Because we have also witnessed that so many of the foreign nationals coming to India, and somebody has developed an infection and they turn out to be a resistant bug and difficult to treat organism and all that. To overcome that, we need to maintain proper sanitation and hygiene in every aspect of life, from the cattle and as well as the common areas we commonly use, and as well as we need to make awareness among the public about this vaccination and emergence of antimicrobial resistance. Without that, it is very difficult. Over 5 years or 5 to 10 years, it will be very difficult for us if this scenario continues. So we need to address it as early as possible. And how to tackle it? We need to restrict antibiotics. There should not be any mercy. Saying that, what I meant is that antimicrobes should be resistant from prescribing from the common area, from pharmacy, and as well as the areas where they get easy access to. And if somebody prescribes antibiotics, there should be a team to monitor that, whether the antibiotic prescription was appropriate or not. So they need to give a feedback on that. In case if that is inappropriate, they need to stop it, and we need to have a close follow-up on that as well.
Thank you, Doctor. I'm sure that would have been an eye-opener for many people. I hope this interview gave valuable insights to manage infections while considering the growing cause of antimicrobial resistance. Thank you.
Thank you so much. Thank you for the opportunities. These sort of a younger generation would come up with the plans to tackle this antimicrobial resistance, and they need to make the people aware that unnecessary use of antimicrobials will definitely help to tackle the problems. Thank you so much.